People frequently use the terms STDs and STIs interchangeably, however, they are not the same. STD refers to a sexually transmitted disease, whereas STI refers to a sexually transmitted infection. Both medical conditions are similar but not identical. STDs and STIs are not the same thing. The key distinction between STDs and STIs is found in the words diseases and infections. An STI is considered an STD only if it causes symptoms. Most sexually transmitted diseases are referred to as STIs. People shudder at the thought of having an STD because diseases are thought to be more serious than infections. Herpes, hepatitis B, human papillomavirus, HPV, and human immunodeficiency virus, HIV, are examples of STIs caused by viruses, while gonorrhea, chlamydia, and syphilis are examples of STIs caused by bacteria. STDs include genital herpes and pelvic inflammatory diseases. The distinction between disease and infection. An infection is the first thing that happens before a disease develops. It is the first step in the progression of a disease. When harmful microorganisms or parasites invade the body, this is referred to as an infection. Infections can start anywhere and spread in a variety of ways, including body contact, fluid contact, and sexual contact. Disease, on the other hand, occurs when an infection spreads to various parts and organs of the body, causing damage. Diseases frequently have obvious signs and symptoms, which is not always the case with some common STIs, such as gonorrhea, which is usually asymptomatic. Before developing into a disease, all STDs begin as a STI. Foreign microorganisms enter your body through a variety of pathways, including bodily fluids such as blood, vaginal secretion, saliva, and sperm. After that, the organisms begin to multiply. Infections become diseases over time as they cause damage to cells and organs. Signs and symptoms begin to appear at this point. In some cases, a STI will never progress to a disease. Human papillomavirus infection, HPV, is one example of this. HPVs frequently disappear on their own without causing other health problems. In this case, they are classified as a STI. However, if they do not go away, they can lead to certain types of cancer or cause genital warts. In such a case, they can be classified as a disease. STD signs and symptoms to watch out for. Depending on the type of microorganism that caused the disease and the type of sexual activity you engaged in, sexually transmitted diseases can affect different parts of the body. Symptoms of an STD may not appear immediately. Signs and symptoms may appear days, weeks, or even years later. Rashes in the genital or anal regions are some common signs and symptoms of STDs to look out for. Bumps or sores around the anus, mouth, thighs, and pelvic area, painful urination, pelvic pain, pain in the vaginal during penetrative sex, penile ejection, vaginal discharge that smells or is discolored, rectal bruising, sensation of tingling around the genitals. How to avoid STDs and STIs. Sexually transmitted diseases/infections are avoidable. However, the only sure way to avoid them is to refrain from engaging in any form of sexual activity, including kissing and oral sex. If you are sexually active, you can reduce your risk of contracting a STI or STD by doing things like sticking with one sexual partner, using condoms while having sex, avoiding or limiting the use of alcoholic beverages and recreational drugs, avoiding needle sharing because some STIs, such as hepatitis B and HIV, can be transmitted through blood, getting vaccinated against STIs such as hepatitis A, hepatitis B, and HPV, avoiding sexual activity with a new partner until they have been tested for STIs. Despite the fact that the Centers for Disease Control and Prevention, CDC, recommends that all sexually active adults get a test once a year. You should consider getting one if you have had sex without consent, shared injection equipment, had sex with multiple partners, and are concerned that you may have been exposed to a STI. It is important to note that STDs such as hepatitis A and genital herpes have an incubation period. As a result, getting tested too soon may miss an infection. To rule out infections, you may need to be tested twice. Your doctor is the best person to advise you on the next step to take based on your situation and the uniqueness of your case.